Hi, everybody. I am Luz Lopez from the School of Social Work, and I am the director of the Global Health Core of the Center for Innovation in Social Work and Health. I'm going to focus on the thousands of migrants from Honduras, Guatemala, El Salvador, and Mexico that look for asylum in the United States, escaping violence from gangs known as Maras, mothers and youth who may be escaping domestic violence, and poor economic conditions. At the onset of the COVID-19 pandemic, a number of anti-immigrant policies were implemented under the disguise of public health efforts. Next slide. One of these policies started in March 2020, when despite no scientific evidence, Title 42 of the US Code determined that migrants coming from Mexico and Canada were in danger of introducing COVID-19 to the United States. As a result, migrants were not allowed entrance and were forced to wait in the Mexico border under terrible, poor living conditions and health conditions. There was limited supply of food, basic needs, no school for children, and violence. Many women were raped and continue to be raped. To help prevent COVID-19 in the border facilities and in the United States, migrants' families and unaccompanied children were not allowed to wait for an immigration hearing, which is their right, but rather they were immediately expelled to their country. Migrants that came and were sent to Mexico border before COVID-19 have been waiting for a hearing for 1 or 2 years. Immigration court hearings have been stopped or very limited. Next slide. This table shows the US Border Patrol monthly enforcement encounter from October 2020 to January 2021. I would like to bring your attention to the number of monthly southwest border expulsions in the Mexico border, 247,116, compared to the northern border of Canada with 134. The number of Title VIII apprehensions in the southwest border was 37,293, compared to 129 in the northern border. Many of these families have been separated, and the children in detention centers without being able to see their parents. Almost 10,000 unaccompanied children, next slide, were taken into custody from September to November 2020. Tens of thousands of people remain in crowded immigration detention centers despite COVID-19 risk. The Biden administration signed several immigration reform bills, but the steps to implement them have been very, very slow. Only 25 families were admitted entrance in the last week. As social workers, clinicians, and public health professionals, we can advocate and serve as resources to provide culturally specific trauma care and services in Spanish. We can also provide adapted evidence interventions to address the long-lasting mental health impact of family separation in thousands of children and youth, as well as the families residing here in the United States. And this is a serious concern that I have. Next slide. And finally, I want to put a reference, a link to a helpful manual available in English and Spanish on talking to children about deportation and separation, because many of us in our field are going to be working with these families and separated children. Thank you very much.